Certified Nursing Assistant 2026 CNA Certification Exam Full Course Checklist Demonstration. Question 1. When measuring a resident's radial pulse, the CNA should use their thumb, their index and middle fingers, a stethoscope, the palm of their hand. The thumb has its own pulse, so the first two fingers should be used to get an accurate reading. Question 2. The first step in any nursing skill demonstration is to put on gloves. Identify the resident and introduce yourself. Lower the bed rails. Gather all supplies. Proper identification and introduction are the foundation of resident-centered care. Question 3. When weighing a resident on a standing scale, the CNA must first make sure the scale is balanced at 0. Help the resident take off their shoes. Ask the resident how much they think they weigh. Give the resident a glass of water. The scale must be zeroed out to ensure an accurate measurement. Question 4. What is the normal range for an adult's resting pulse? 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 140 beats per minute, 20 to 40 beats per minute. The standard normal range for a resting adult is 60 to 100 bpm. Question 5. When measuring respirations, the CNA should tell the resident to breathe normally. Count for 15 seconds and multiply by 4. Count while appearing to still be taking the pulse. Ask the resident to hold their breath. If a resident knows you are counting their breaths, they may change their breathing pattern involuntarily. Question 6. Where is the radial pulse located? On the neck, on the thumb side of the wrist, on the pinky side of the wrist, behind the knee. The radial artery runs along the thumb side, lateral aspect, of the wrist. Question 7. Before transferring a resident from the bed to a wheelchair, the CNA must lock the wheels on the wheelchair, lift the resident by the arms, have the resident wear only socks, keep the bed in the highest position. Locking the wheels is a critical safety step to prevent the chair from rolling away during the transfer. Question 8. When using a gait belt, where should it be placed on the resident? Around the chest, around the neck, around the waist, over the clothing, around the hips, under the clothing. The gait belt should be at the waist to provide a secure grip for the CNA without causing injury. Question 9. During a bed bath, what part of the body should be washed first? The feet, the back, the face, eyes first, the perineal area. Washing from cleanest to dirtiest prevents contamination. The face is considered the cleanest. Question 10. When performing range of motion (ROM) exercises, the CNA should move the joint quickly, stop if the resident complains of pain, force the joint past the point of resistance, perform each exercise once. ROM should be gentle and never forced. Pain is a signal to stop immediately. Question 11. To measure the height of a bedbound resident, the CNA should use a tape measure while the resident is lying flat. Estimate based on the size of the bed. Wait until the resident can stand. Ask the family. A tape measure can be used to measure from the top of the head to the soles of the feet while the resident is supine. Question 12. When emptying a urinary drainage bag, the CNA should touch the tip of the drain to the graduate container. Place the graduate on the floor. Wipe the drain with an alcohol swab after emptying. Check the color and amount of urine. Cleaning the drain tip with alcohol helps prevent infection, though observing the urine is also important. Question 13. What is the Sims position used for? Eating, administering an enema, sleeping on the back, walking. Sims position, left side lying with the right leg flexed, is the standard position for rectal procedures. Question 14. When measuring blood pressure, the brachial artery is found at the wrist, at the inner elbow, antecubital space, in the groin, on the foot. The blood pressure cuff is placed above the brachial artery in the arm. Question 15. The systolic pressure is the bottom number of a BP reading, top number, representing the heart contracting, pressure when the heart is at rest, the pulse rate. Systolic is the maximum pressure during a heartbeat. Question 16. When assisting with a bedpan, the wider end of a standard bedpan should be pointing toward the head, pointing toward the feet, facing the side of the bed, under the resident's knees. The wide part of a standard bedpan goes under the resident's buttocks. Question 17. Before feeding a resident, the CNA should offer the resident a chance to wash their hands, make sure the resident is lying flat, puree all the food, tell the resident to hurry up. Hand hygiene for the resident is an important part of dignity and infection control. Question 18. When performing foot care, the CNA should never soak the feet in warm water, apply lotion between the toes, dry the feet thoroughly, check for redness or sores. Moisture between the toes can lead to fungal infections and skin breakdown. Question 19. How many times should each ROM exercise typically be repeated? 1 time, 3 to 5 times, 10 to 15 times, 20 times. 3 to 5 repetitions is the standard for a nursing assistant skills exam. Question 20. After finishing a skill, what is the final safety check a CNA must perform? Turn off the lights. Ensure the call light is within reach. Leave the room immediately. Lower the head of the bed. The call light is the resident's lifeline to the staff and must always be accessible.